Steps in bacterial protein synthesis and targets of several antibiotics. Amino acids are shown as numbered circles. The 70S ribosomal RNA complex is shown with its 50S and 30S subunits. The first step is the charged tRNA unit carrying amino acid 6 binds to the acceptor site on the 70S ribosome. Second, the peptidyl tRNA at the donor site with amino acids 1 through 5 then binds the growing amino acid chain to amino acid 6. Third, the uncharged tRNA left at the donor site is released. Fourth, the new 6 amino acid chain with its tRNA shifts to the peptidyl site, or what you call translocation. The antibiotic sites are shown as triangles. Chloramphenicol or C and macrolides or M bind to the 50S subunit and block peptide bond formation. This is the step 2. Tetracyclines or T bind to the 30S subunit and prevent binding of the incoming charged tRNA unit. This is the step 1. 30% for chlortetracycline, 60 to 70% for tetracycline, oxytetracycline, demeclocycline, and metacycline. 95 to 100% for doxycycline and minocycline are the percentage for the absorption when the drugs are taken orally, and there is poor absorption of tigecycline. These are distributed widely to tissues and body fluids except for cerebrospinal fluid. Short-acting, which are distributed for only 6 to 8 hours, are chlortetracycline, tetracycline, and oxytetracycline. Intermediate-acting, which are distributed thoroughly after 12 hours, are dimeclocycline and metacycline. And the long-acting, which can be distributed after 16 to 18 hours, would be doxycycline and minocycline. Tigecycline has a half-life of 36 hours, which is considered longest among the other tetracyclines. It may be its way of excretion is through the bile and urine. It is used as a treatment for infections caused by Rickettsia and for Mycoplasma pneumoniae, chlamydia, and some spirochetes. It is also used to treat gastric and duodenal ulcer and some other more clinical uses. These drugs can be toxic when too much from the normal dosage is taken or mistake in the way of introduction. It can impair hepatic function and cause hepatic necrosis. Also, renal tubular acidosis and Fanconi syndrome. The DNA is shown as a circular double-stranded within the bacterial cell. Like the DNA of all living organisms, it contains the unique genetic code for all of the proteins required for bacterial survival. This includes the proteins required for reproduction, growth, repair, and regulation of metabolism. It also codes for the 3 kinds of RNA that are essential for carrying out protein synthesis. These are known as the ribosomal RNA or rRNA, messenger RNA or mRNA, and transfer RNA or tRNA. In order for the bacteria to begin protein synthesis, the double-stranded DNA molecule must first unwind and separate in the region which codes for the specific protein that is to be made. Only one strand of the DNA serves as the template for this process, known as transcription. Transcription results in the formation of messenger RNA, which is a mirror copy of the DNA segment. Once the strand of mRNA is complete, it will detach from the DNA template and in turn become attached to ribosomes. Bacterial ribosomes are made of a small 30S and a large 50S subunit. After the 2 subunits join together around the strand of mRNA, synthesis of the polypeptide chain begins. This step involves aligning of transfer RNA molecules in sequence along the mRNA. Each tRNA carries a unique amino acid, which then align along the mRNA ribosome, join together to form the polypeptide chain. This step is known as translation. The ribosome will continue to add amino acids to the growing polypeptide chain until it reaches a point along the mRNA that signals it to stop. At this point, it releases the finished protein molecule. Macrolide antibiotics such as erythromycin act as inhibitors of protein synthesis by attaching to the 50S ribosomal subunit. By doing so, they block the ability of the ribosome to synthesize the polypeptide chain. By inhibiting protein synthesis, macrolides are considered bacteriostatic antibiotics. However, at higher concentrations and with lower bacterial density or during rapid bacterial growth, macrolides may be bactericidal. Changes or modifications to the 50S ribosomal subunit will confer resistance to macrolides and sometimes other classes of antibiotics. This type of resistance may be of a high level. This mechanism of resistance is mediated by the or erythromycin ribosome methylation gene, which is found on plasmids or transposons. Copies of the gene are transported to other bacteria via plasmids or transposons through pili-like channels. The gene is incorporated into the new bacterial genome. During the process of protein synthesis, this bacterium will transcribe and translate the genetic code of the gene, resulting in the production of a protein enzyme capable of methylating the 50S ribosomal subunit at a specific position. This altered 50S subunit results in decreased binding affinity for macrolides and other antibiotics such as nincosamides and streptogramin type B. This pattern of resistance is referred to as the MLS phenotype. Because the macrolide antibiotic is unable to bind to the 50S ribosomal subunit, it is unable to inhibit protein synthesis, and thus the bacteria itself is not harmed, continuing to produce polypeptide chains of amino acids. A second mechanism of bacterial resistance to macrolide antibiotics is mediated by efflux pumps. These efflux pumps are encoded by the MEF-A gene, which is transposable element. Because they confer resistance to only macrolides and not lincosamides or streptogramin B, they are referred to as the M phenotype. The efflux pumps are energy dependent and for S, Newman A, result in moderate levels of resistance. These pumps traverse the cell other bacteria such as Staphylococcus aureus, for example, a different efflux system which is plasmid mediated and encoded by the MSRA gene results in macrolide resistance as well as lincosamide and streptogramin resistance in some cases. Despite the presence of these efflux pumps, macrolide antibiotics continue to enter the bacteria. However, once inside the cytoplasm of the bacteria, these efflux pumps actively remove the macrolide antibiotics before they have a chance to reach their target. The 50S ribosomal subunit and bacterial protein synthesis is unaffected.
Ketolides. The first ketolide antibiotic to enter clinical use is telithromycin, and it is marketed as Ketec. For its mechanism of action, structural modification of these compounds renders them poor substrates for efflux pump mediated resistance, and they bind to ribosomes of some bacterial species with higher affinity than macrolides. For its pharmacokinetics, 57% is oral bioavailable, and it is good in penetrating tissue and intracellularly. It is administered as once daily at 800 milligrams with peak serum concentration of 2 microgram per milliliter. It goes to the liver and excreted through biliary and urinary routes. It is also a reversible inhibitor of cytochrome P3A4 enzyme system that can slightly prolong QTc interval. For its clinical uses, it is an active in vitro against various bacteria, and many macrolide resistant strains are susceptible to ketolides. However, it has adverse effects such as hepatitis and liver failure. Chloramphenicol. Chloramycetin sodium succinate, and chloracol are some examples of chloramphenicol available in the market. For its mechanism of action, it binds reversibly to the 50S subunit of the bacterial ribosome and inhibits peptide bond formation. For its pharmacokinetics, in adults, it is administered as 50 to 100 milligrams per kilograms, and for infants, it is administered as 25 milligrams per kilograms. The oral administration is rapidly and completely absorbed. 1 gram is equal to 10 to 15 microgram per milliliter. It is distributed to all tissues and body fluids, including CNS and CSF. For its clinical uses, chloramphenicol is a broad-spectrum antibiotic. 10% of the total dose administered and inactive degradation products are excreted through urine. This is for serious rickettsial infections like typhus and Rocky Mountain spotted fever. It is also an alternative for beta-lactam antibiotic for bacterial meningitis in patients with hypersensitivity with penicillin. It is also topically used for eye infections. However, there are a lot of adverse effects for chloramphenicol, like gastrointestinal disturbances, oral or vaginal candidiasis, aplastic anemia, which is irreversible, gray baby syndrome for infants given higher than 50 milligrams per kilograms, and it inhibits hepatic microsomal enzymes, which causes prolonged half-lives and serum concentration of phenytoin, tolbutamide, chlorpropamide, and warfarin. Oxazolidinones. Linezolid and tedizolid are examples of oxazolidinones that are available in the market. For its mechanism of action, it binds to the 23S ribosomal RNA of the 50S subunit without cross-resistance with any other drug. For its pharmacokinetics, if it is administered orally, it is 100% bioavailable with 4 to 6 hours half-life. At 600 milligrams, it is administered twice daily, orally or intravenously, with peak serum concentration of 18 microgram per milliliter. It is used in the following: against gram-positive organisms and also in M. tuberculosis, for vancomycin-resistant E. faecium infections, healthcare-associated and community-acquired pneumonia, both complicated and uncomplicated skin, and soft tissue infections caused by susceptible gram-positive bacteria. However, it has adverse effects like thrombocytopenia, anemia, and neutropenia in patients with predisposition, optic and peripheral neuropathy, and lactic acidosis for prolonged uses, and serotonin syndrome if co-administered with serotonergic drugs.